Hello, my name is Dr. Anita, and I'm an optometrist practicing in Lagos, Nigeria. It's so good to be at Vision Show today. So today we're talking about coronavirus and how it has been a surprising catalyst for the adoption of telemedicine globally. Now, coronavirus took the entire world by storm, surprised the entire world. Nobody saw such a pandemic coming. No country was ready for it. Everybody was playing catch up to the virus. Every industry, every economy was hit financially and in so many ways. The healthcare industry was probably the worst hit, with we suffering from loss of lives, sadly. We suffered from loss of personnel, we suffered from loss of resources, we suffered from loss of finance and depletion of our resources. And hopefully, this pandemic shine the light on the healthcare system and how important it is globally. And countries will start paying more attention to their healthcare systems. Now, a lot of hospitals cancelled, a lot of eye clinics had to shut down this period. I know in Lagos, Nigeria, we had to close for a while, and a lot of non-emergent services stopped. And so the effects that we'll begin to see from patients who had chronic conditions that needed regular care, that needed regular checkups, that needed regular visits, and could not get into hospitals or clinics. I feel like we'll start seeing the effect of those things in the coming months. Even WHO was reporting, as I read a few days ago, that over 70% of people who had chronic conditions have not been able to access healthcare as we fight COVID-19. And so that's a large number. That's a huge number of people that are at home and cannot get healthcare because they are scared to come outside, or they don't want to come into the hospitals because hospitals are like hotspots for contacting the virus. And so this necessitates we thinking of innovative ways to get healthcare to our patients, to get through to our patients without having them come in if they can't. That's where telemedicine comes in. Telemedicine has been around for a while. It's just the use of any communication device or any electronic device to deliver healthcare or health education in lieu of patient visits. Now, this has been around for a while, and people have been adopting it, but the adoption has been slow. Like, I think from 2014 to 2019, there was about a 23.7% growth in the industry generally. But 2020 and coronavirus just changed that dynamic completely, with the WHO reporting that over 50% of primary healthcare services around the world are now being done via telemedicine. Now, that's a huge number. That makes us eye care professionals have to think and say, okay, what do we do? Do we get into this? Do we get into telemedicine? Do we start using it? I know some eye clinics already adopted it. What used to hold most people back, most healthcare professionals or practices, from buying into telemedicine before was also the reimbursement thing and policy issues. A lot of people had issues with reimbursement because some health maintenance organizations, HMOs, and insurance companies were not buying into the idea of letting patients use telemedicine. I think they feel like patients will use it excessively if they have access to telemedicine. But right now with coronavirus, a lot of all those blocks have been removed. A lot of all those restrictions have been pulled out. And so now is the time where healthcare professionals are getting into telemedicine and figuring out how to use it. Should we as eye care professionals get into it? Should we consider it as a viable option? Let's look at the pros and cons of telemedicine. Now, one of the most important things is the convenience of it all. It's so convenient for the patient, it's convenient for you, a practitioner, to sit in your office, sometimes even consult from home and be able to get healthcare to the patient. It's convenient for the patient, and sometimes a 24-hour care service is marketed to the patient that you can call, you can reach a doctor at any point, at any time of the day. Now, that's very convenient for a patient, not having to think of your opening hours, not having to think of the clinic's opening hours, not having to think of getting there on time or getting there before you close. And so it's really convenient. There's also getting to people living in remote areas, which is what telemedicine was marketed for, especially here in Nigeria. We had a lot of people staying in rural areas that could not get certain eye care specialists, or could not get certain specialists to attend to them in those remote areas. And so they could say, okay, we'll get telemedicine to you, with telemedicine you can contact a specialist, you don't have to come to this state. And so it means that no matter where the person stays, you can get access to healthcare. Now, it's more important in these times where travel is restricted in some places because of lockdowns and all of that, it's easier for patients in remote areas to access care now if they can just do it via a smartphone or their laptops or get their tablets and get a doctor and speak to a doctor immediately. And so I think it's easy to get to people in remote areas. Now for us, we also have to consider the protection in these times where we're fighting COVID-19. We said we have stand a lesser risk of exposure to the virus if not every patient that we see has to come in. The less people who come into the clinic, the less people who enter the clinic, the less chances of we being exposed to the virus. And so it offers protection for us. It offers protection for the patients, the same type of protection. Now you have to understand in eye care, so a lot of the patients we see are geriatric patients, right? And so these people stand a high chance of morbidity from the virus. And so protecting them means looking for ways to get to them without necessarily exposing them or having them come outside. And so that is also one of the pros or one of the advantages of using telemedicine, because we have protection, we have a little bit of protection in the season when we do not have to, they don't have to come in, we don't have to get an inpatient visit or see them physically. And so that's one of the advantage. I think it's also a way of revenue generation for us as healthcare professionals, because if we introduce telemedicine into our practice, we are introducing a new source of income, kind of. Now, because we have patients who are not coming in, who are missing appointments, and who we cannot get revenue from. If those patients can consult via telemedicine, even if we don't charge them the full amount, if we charge 3/4 of what we would have charged, or even half of what we would have charged for an inpatient visit, we will still make up some of the losses that we have incurred in this season. I know a lot of clinics, a lot of people have a lot of practices have suffered financial loss this season, and some of them are just barely managing to hold up and not have to fire staff. And so if we can introduce telemedicine into our practice, that's another way of getting revenue. It's another way of even increasing your patient load, because if a lot of people notice that this clinic is offering this service and this clinic is not, people might even switch doctors, switch practice and buy into your practice. You can attend to people from different states in different region. If they can get to you, it means the person doesn't have to be in your state to use your clinic. It means you can attend to people from anywhere around the country or even around the world. And so that's a huge benefit of using telemedicine. Now it's not without its faults though. One of the most important things is, if you have to start a new technology, you have to train, which means from your front desk to your doctors to every member of your staff, even your financial officers, they will have to undergo training on how to use telemedicine, on how to go about charging patients, all of that. And so the entire retraining process of your staff will have to be done. There is also the biggest fear of mismanagement of patients. How do you know that you are offering the best care when the patient is not here, is not with you there? Even the patients will have this doubt on the part of the patient, though. A lot of patients are already used to doctor-to-patient consultation in a clinic setting, and so it's going to be hard for them to believe that the same amount of care would be afforded to them if they don't come in, if they just talk to you via the phone. So it will take a lot of convincing to get a patient to start believing that they are getting the same amount of care that they would have gotten in the clinic. Now, even for eye care professionals, where we understand that a lot of our tests are standardized and are done in standard environments with lights and all of that, how do we begin to move from conducting and interpreting the VHR to doing VA via a smartphone? Do we interpret it against the same metrics? There are a lot of gray areas and all of that. And so those are like some of the issues that we'll start having to deal with and start having to explain. But I do believe it will work for some conditions that do not necessarily require those standard environments for us to do. So that's one of the major problems, the fear of mismanagement. There's also fear of electronic glitches. Now, internet connectivity is not the same all over the world. It's not the same all over the states. In some states, it's not all over the state, and it's not the same all over the country. Which means that there are some people who do not have the same access to internet or the same access to certain electronic devices. Now, does that mean that those people shouldn't access healthcare when they need it? does that mean that you're cutting off those people from accessing healthcare? I think it further widens the gap that exists between different classes of people in healthcare accessibility if we completely introduce telemedicine. So that's one of the greatest fears too of introducing telemedicine. The fact that some people will not have access to internet, some remote areas that you are trying to reach might not be able to access internet, will not have internet. Here in Lagos, Nigeria, we have a lot of problems, not necessarily in Lagos, but in some areas in Nigeria, we have the same issues with getting to people in remote areas that do not have good internet connectivity. And so that's one of the problems. But as healthcare professionals, as eye care professionals, we have to still weigh it and consider these pros and cons and see if it is time to actually start thinking of using telemedicine, and weigh and see, especially in this time, if it makes sense for us to get into telemedicine to keep our practice viable. I think it's here to stay. I think the question most people ask is it sustainable? Will it stay even after the coronavirus is over, after we've dealt with the coronavirus or found a way to manage it? Will we still go back to using telemedicine? Will we still be using it with the same vigor and all of that? I think it is here to stay. It may not keep up the same pace of growth, but it won't go back to the way it was before. So I think to keep your practice viable, to keep yourself relevant, we have to find a way to buy into this. We have to find a way to get our practice into this. We have to find a way to get into this somehow. And so I think it's a viable industry. It's an industry that is here to stay. It's a part of medicine that has come to stay. And we have to position ourselves, consider the risk, weigh it, and figure out how to manage ourselves and get ourselves into it. Thank you.